Hi there, welcome to Dental Philosophy. In this video, we're going to talk about root canal treatment. Now, root canal treatment is a procedure that often gets a bad reputation, but it's truly a tooth saver. Today, we're going to demystify it by exploring what it is, when it's needed, how it's done, and what to expect after your treatment. The reason why a lot of people associate root canal treatment with pain is because there are lots of negative stories or word of mouth online. And a lot of people associate a root canal treatment with severe dental issues that may require complex treatment. And also, there can be a little bit of discomfort even after the treatment has been done. And for that reason, a lot of people associate it with a treatment failure. The reality is that modern root canal treatments are safe, effective, and typically no more painful than having a filling. So, what exactly is a root canal treatment? Well, a root canal treatment is a dental procedure that is performed to save a tooth that's badly decayed, infected, or traumatized. It is often the last chance to save a tooth that will otherwise need to be extracted or removed. A root canal treatment is also commonly called endodontic therapy. Now, endodontic therapy or root canal treatment both involve the removal of the dental pulp. Now, the dental pulp is a collection of blood vessels, nerves, and connective tissue inside the tooth. All of these three elements help to keep the tooth alive. Now, when might somebody need a root canal treatment? If you're experiencing persistent toothache or pain that just doesn't go away, sensitivity to hot and cold foods and drinks, swelling or tenderness around the teeth, discoloration of the teeth, damage or trauma to the teeth involving the dental pulp, or you've had a root canal that basically has failed and now need retreatment. These can all suggest that you may need a root canal treatment. So, what happens at the dentist? Well, first of all, the dentist will need to get your consent before starting to make an assessment. Following that, they will need to get your medical history. Now, the reason why dentists need to take a medical history is to identify any conditions, medications, allergies, and anything that will affect your dental treatment. This also ensures patient safety as well as preventing complications and to tailor your treatment accordingly. After that, your dentist will make a series of assessments in order to come up with a diagnosis. They will take a detailed history of your signs and symptoms, check for decay, swelling, or tenderness. Following that, there might be more tests, including a cold test, an electric test, or a bite test. All of these tests are basically to establish whether the root canal is the appropriate treatment for your tooth. Your dentist will also take x-rays to help with making a diagnosis. An x-ray will basically show some obvious fractures. Sometimes it can show the complexity of the work that's needed to be done. Sometimes the normal x-rays, which are 2D view, may not give the dentist enough information to make a diagnosis. Your dentist may then have to ask you in these instances to have a CT scan done. The CT scan basically is a 3D view of the tooth and it will show a lot of information compared to a normal x-rays. The CT scans normally have a higher dose of radiation, but we don't take them unless we have to, as a result of the high dose of radiation that CT scans have. However, there are newer CT scans being developed to make sure that the dose that the patient receives is much lower. So after all that, your dentist should be able to come up with a diagnosis, following which they will give you a range of treatment options. One of the treatment options we have in dentistry is actually do nothing. That's when a patient has decided that they don't want to go ahead with the recommended treatment. If you do give consent, your dentist can then start to carry out the work. Sometimes your dentist will decide that the work is quite complex and to the level where they may not be able to achieve the best results, and they will recommend you see somebody that has a special interest in root canal treatment or somebody who is a specialist in root canal treatment. In this case, they are called an endodontist. Sometimes, before all of that, your dentist will actually say the tooth is not restorable. In this case, the other option will be to actually extract the tooth, unless if you want a second opinion from another dentist. but usually your dentist will act in your best interest and give you the appropriate advice. Once you have decided that you want to go ahead with the treatment, the first step will be for the dentist to numb you up. Sometimes they will give you a numbing gel to numb up the area before the injection is given. Following that, they will also apply something called a rubber dam. This is basically to isolate the tooth that the dentist is going to work on. The rubber dam also acts as a protection in terms of the disinfectants that the dentist is going to use for the treatment. These disinfectants can sometimes cause irritation to the soft tissues, hence having the rubber dam will avoid all of that or any incidents happening. So your dentist now has started the treatment. In step one, basically, is to open an access cavity. Your dentist will go to the center of the tooth and create a minimal entry as possible to conserve as much of the tooth as possible. As you can see, the drill has just gone in, has removed the caries on the surface of the tooth, and now your dentist can access the pulp cavity where you have the blood vessels and the nerves inside the tooth. After this stage, your dentist will then go to stage two, which is to start instrumenting and removing the infection and the dead tissue from inside the tooth. And this is basically where the nurse will be suctioning it as well. So you can see more instrumentation. Now everything is clear. So in the next stage is where your dentist will fill this canal now. So they will dry it, everything is fine, and they will fill the canal. And these are root canal fillers, you can see. It's basically made up of gum. This material is a special wood that doesn't react to anything. So basically it's to use that to close the canal. Once they finish that, they will chop it off, and then there will be some space left on the top of the tooth. That's for placing the filling. Now, if your dentist has finished the work, they will place a permanent filling. And if they haven't finished the work, then they can place a temporary filling. And the temporary filling is easier to remove in the next appointment. And whereas the permanent filling means the work is completely done. In this case, you can see they've used a tooth-colored material there. So that's where the filling starts all the way to the top of the tooth. And so that you'll be able to use the tooth as soon as possible. So after all of that, your root canal treatment has been completed. Your dentist will go on to give you aftercare advice, and some of this may include taking normal painkillers and obviously to keep a good oral hygiene, as well as dietary advice in terms of avoiding hard foods. Your tooth might feel a little bit tender after the injection is worn off, but in most cases, the painkillers will be able to make things feel easier. And finally, remember a root canal is effective and saves natural teeth. Ask your dentist if you have any concerns. Thank you for watching and see you next time.